infections are a common finding. The scrotum is pendulous, edematous, and covered with rugae. Dark-skinned newborns have deeply pigmented scrotum. Both testes should be descended. If the testes are not descended, it's called cryptorchidism. And sometimes that has to be surgically repaired, because if you cut off circulation to that testes, it's going to die. Okay. All right. Extremities. They're flexed. They like to roll up in a ball, right? They have good muscle tone in their extremities. If you pull them out, they're going to go right back in. Their extremities are short in relation to the body. They have a full range of motion. 10 fingers and toes. They may have an extra digit on their fingers or toes, or it may be webbed. Okay, so if it's webbed, then it's usually the middle two fingers. It'll be webbed in between the fingers, and most of the time the doctor can just clip that because it's skin. Now sometimes it's more than just skin, all right? And then polydactyly is too many fingers. Now you have to be careful, but you have to open their hands, because they'll tuck that little one inside. You won't see it. It'll be tucked, it'll be small, and it'll be tucked in. All right, so syndactyly is the webbing. Polydactyly is too many digits. Okay, it's usually fingers. I don't know if I've seen toes or not. I don't think so. You need to look for a simian crease across if they have one crease across their hand, that can indicate Down syndrome. Okay. And they call that a simian crease. I assume monkeys have it, I don't know. Brachial pulses should be present and equal. They should have creases covering at least 2/3 of the bottom of their feet.
Okay. Exam 7 is on the 12th.
They're going to have, if they have a strong brachial pulse and a weak femoral pulse, you need to report that. That's not normal. Okay. All right, so they show you on page 282 Ortolani and Barlow maneuvers. If you can see me, I'm going to show you kind of how that goes. All right, so the purpose is we're looking for a dislocated hip. Write that down. So you've got the baby in front of you, okay? You hold his knees closed, if you look at the picture on the right, and you push him towards the baby, you bring him back, and then you go out. You go out 90 degrees, that's a question.
Okay.
Somewhere, maybe on your exam. Okay, so they're looking for hip dislocation. If it's dislocated, it's going to click. They're going to feel it.
8 is going to be on the 12th.
Okay. Back and rectum. Their spine should be straight and flat. No masses, no openings, no dimples or tufts of hair. Don't know what a tuft of hair is. It's just a little bit. Okay. The anus should be patent. We will know it's patent if they pass meconium, okay? And they should pass meconium within 24 to 48 hours. We do not want to use a rectal thermometer. Don't be surprised. They shouldn't do it. You can perforate a bowel. All right, neurologic exam. You're going to have to do part of this exam when you can get it done. When they're quiet or asleep, you can do their heart and lungs. Okay, you got to count fast, right? And they need to be quiet and still. If they're flopsy-bopsy, hypotonus, that's abnormal, as is hypertonus. If they're hyper, they have a high-pitched cry, they're jittery, or any of that, something's wrong, right? If it's jittery, they can have low blood sugar, right? Or mom could have been a drug addict and the baby's coked up, right? So all of those things.
8 is on the 14th.
It says reflexes should be tested at the end of the
And the
exam.
final is on the 20th.
If you're going to start messing around, you need to do that at the end.
When we get through with exam 9, I'll try to run
The newborn should demonstrate the protective reflexes of sneezing, coughing, blinking, and withdrawing from painful stimuli. Brooding, sucking, and swallowing reflexes are important to the newborn's nutritional intake. Gently stroking the newborn's cheek brings out the brooding reflex. You can do this, look at me. You can do this on the side of the baby's face and they'll start trying to suck. You can do this in nursing homes with old people. If you, that stimulates that urge to eat. Okay. All right. Evaluate the palmar and plantar grasp reflex. If you put your finger in a baby's hand, they're going to close their hands. If you do it under the base of their toes, they're going to curl their little toes. So that's the palmar and plantar grasp reflex. They may have the stepping reflex. There's a cute picture of that on page 284. I thought my oldest son was a genius because when I gave him a bath, he started walking when I turned him over on my hand. I went, yes, he's a genius, but that's just a reflex, sorry. I don't think I test you on Babinski. Don't worry about that. We'll eliminate that. How's that? The Moro reflex is known as the startle reflex. If you bump the crib, if you drop something loud, if there's a loud whatever, they're going to do like this. I call that the cheerleader move, okay? They've got their little hands in the C. It should be symmetrical, in other words, both hands. It disappears in about 6 months. Tonic neck reflex is another total body reflex. With the newborn lying quietly on his or her back, turn the head to one side. Without moving the body, the newborn responds by extending the arm and leg on the other side. Okay, this is not the same as just looking. Okay, they're going to do like this, which is the fencer's position. Okay, that is the tonic neck. Okay, behavioral exams. So it says that they have self-soothing capabilities. You don't have to pick them up every time they wake up. But we all like good babies, okay? So if they're good, you're more likely to hold them. If they're pushing away from you and screaming, you're going to be less likely to be warm and fuzzy, right? All right, so instruct the parents to watch the newborn for cues as to when he or she wants to interact. The quiet alert state is a good time for focused interaction with the newborn. So mom and dad need to get all warm and fuzzy during that quiet time, okay? Tells you how to soothe the baby. They don't say put them on top of the dryer in their little seat, which is disappointing. I think that's a good one. Okay, so it says you cannot spoil a newborn. All right, I'm not doing the questions. You're on your own. See how warm and fuzzy I am? Because y'all are being good. Okay. 14 is a bear. 15 is a bear. So let's get going. I'll do lecture on 14 and then we'll take a break, okay? All right. So, newborn stabilization period is that first hectic moment after they're born, okay? The first 6 to 12 hours are the critical transition period. In some facilities, the newborn's taken to a transition nursery after a short initial bonding period with mom. It's not that short. It's usually 2 hours, okay? It says immediate data collection of the newborn is concerned with the success of cardiopulmonary adaptation as discussed in chapter 13. So we need to get them breathing and their heart beating and all of that stuff. All right. So first 6 to 12 hours is the transition period. Measure the heart and respiratory rates at least every 30 minutes during the first 2 hours. Monitor the axillary temperature every 30 minutes until it stabilizes in the expected range. 36.5 is my number. And be alert for signs of hypoglycemia. What did we say the first one is? Jitteriness.
Jitterness.
Yeah, they're going to be like that. It says a full physical exam is completed within the first few hours, and it says details in chapter 20. We'll get to that. So, selected nursing diagnoses. I don't do this a lot. The first one is impaired spontaneous ventilation. Second one is thermoregulation. The third one is hypoglycemia. And then risk for infection. Risk for imbalanced fluid volume related to immature blood clotting mechanisms. Unless something's really wrong, I don't think that one is going to be the common one, okay? Misidentification. Well, we have all these little things now that we put bracelets on mom and dad and the baby in the delivery room and anybody else who's going to come, okay? They have to have that bracelet on. It's a locked unit, and they can't get in without that bracelet. I don't care if you've seen them every day for a week. They don't have that bracelet on, they can't come in. Okay. Oh, we talked about putting the baby in the warmer. We talked about suctioning. We talked about wrapping them. We talked about giving them a bath, right? Tells you all that in the paragraph before the next to the last one. And then it tells you how to count by putting your finger on the base of the umbilical cord. It says count it for 6 seconds, multiply it by 10. Pulse above 100 beats per minute, and a vigorous cry reassuring. I would rather see that done the other way. Count it for 10, multiply by 6, but that's not on your exam, I don't think. I'm pretty sure it's not. All right, give constant attention to the airway. If they're born by a C-section, you know you're going to have goop coming out for a long time. You want to suction their mouth first before their nose, because if you don't, they're going to go and suck all that stuff right into their lungs. So suction their mouth first and then their nose. All right, we talked about cold stress. Oh, here's the PERV page, page 290. Look at the guy. Would you let him touch your child? Look at his eyes. Whoa, yeah, he just
looks a lot. He just looks a little high, Miss White. That's just a little high.
Oh, well, that could be it. That could be it. And I haven't caught my children that way in a little while. Okay. We're talking about losing body heat. We know about all that. The kangaroo thing is what he's demonstrating, skin to skin, with mom or dad, with a blanket over them. There is a question about kangaroo care on your exam. You want a thermoneutral environment. That means not too hot, not too cold, right? When we talked about hypoglycemia, mom's going to say, my baby's just too tired to eat. He's not hungry, whatever. They don't have the strength and the energy if they don't have the blood sugar, right? So you need to make mom feed them. The nurses in Lebanon said that the best way was half breast milk and half formula. That got them back up where they needed to be. So it shows you where and how to do a heel stick, and that's how we're going to get blood from a baby. You're going to use those green areas on the back side of their heel, okay, because they don't have any nerves there, and that's the reason. If you do it and you don't get 50, what are you going to do? This is a test question. If you don't get 50, what are you going to do? You're going to call the lab and say, we need a venous sample, okay, to test for blood sugar. So that's the answer. Call the lab. Oh, yeah, it talks about the breast milk and the formula on page 292. They talk about IV dextrose, but we really don't do that much anymore. They will gavage feed. That means they're going to drop a tube down into their stomach. That's gavage feeding. Excuse me. Then we put the goop in their eyes. That's to prevent the ophthalmia neonatorum, which they get from mom's birth canal. We usually use erythromycin. That's a test question. They have used other things in the past, okay? The umbilical cord stump is a place for infection. You need to wash your hands. Strict aseptic technique. Often an antiseptic solution such as triple dibisoprolol or providone iodine are initially painted on the stump. They used to use triple dye all the time. It's kind of dark blue or whatever. I don't see that as much anymore, but just keep that in mind. All right, so their liver's immature and doesn't make clotting factors, so we're going to give them vitamin K. It says in the adult, normal flora in the intestines manufacture vitamin K, but the intestines of the newborn are sterile as symbiotic bacteria have not yet colonized, okay? So we're going to give them vitamin K. We usually give vitamin K in one thigh and Hep B in the other, okay? And we do that right away. We don't put that off. And I told you aquamaphytin was the name of it. All right, we talked about misidentification of babies. You don't want to have a baby stolen, as the saying goes. You want to be suspicious of people who don't belong in your unit if you're in labor and delivery. They'll frequently say, here's the profile of the abductor at the top of page 294. I'll let y'all read that. It's usually somebody that doesn't belong there. They'll say, I forgot my name badge. You've seen me before. Don't you know me? They may be carrying a big pile of laundry, which may be a baby in a big pile of laundry. It's usually younger women who can't have children, who've had several miscarriages. Their husband wants a baby desperately, whatever. Early signs of sepsis in the newborn include poor feeding, hypoglycemia, irritability, lethargy, apnea, and temperature instability. Those are early signs. Late signs are an enlarged spleen and liver, jaundice, and petechiae. Do y'all know what petechiae are? Those little purple spots. Okay. Some of this we've already gone over, so I'm not going to harp on that. Okay. It talks about a 3-minute surgical type scrub at the beginning of a shift. When we went to Centennial, they did that with my students that were going into the nursery. And 3 minutes is a long time, but it's necessary. And it's that little sponge thing that has the soap in it, a little pointy thing to get under your fingernails. They're not kidding, okay? No artificial nails. I don't want to hear that they're gel nails. They are artificial. They are not your nails.